Hi, I'm Maureen Curis with Radiant Morning, and today I'm here with Kathy Perko. She is a pediatric nurse practitioner and the director of Bridges Palliative Care at Dornbecker Children's Hospital, part of OHSU in Portland. So one of Kathy's areas of expertise is caring for children and their families when they're not expected to live a full life. And she is just an amazing asset to them. She has been named one of the nurses to watch, probably many times, but she's just an incredible palliative care expert. And so, Kathy, thank you so much for joining me today.
Well, thank you. Thank you, Maureen, for the opportunity to join me.
So I invited Kathy here to explain what palliative care is. So, Kathy, what is palliative care?
So palliative care, when you look up the word palliative, it actually means to cloak or to cover. And I think the way we like to think about that is that it's a way that we cloak or cover our patients in all the things that they need in terms of whole person care. So it's an added layer of support for whatever that patient and their family needs, which is going to be different likely for every person and their family based on who they are culturally and religiously and how they grew up and where they grew up and all of those things.
Wow, that's amazing. So is it, what does it include? What does palliative care include?
So palliative care really includes the whole person care. So I think of it as, I think a lot of people think of it as pain management, which can be part of it. So pain management, symptom management for things like nausea or nerve issues or headaches. It's also psychosocial support. So your family. For my work, it's a lot of work around siblings as well. And I think when we think about pediatrics, we sometimes think it's so different than adults, and it's not, because adults have siblings, they have children maybe instead of parents, but it's this idea of the whole family and whole family care. And then also faith beliefs and cultural beliefs that are important. And then one of the other things that palliative care done well includes is community. So who is in the community to support those people? Is it an older person that's going to go home that might also need a connection to Meals on Wheels? Is it somebody that's going home and can reconnect with other community resources based on their faith or culture? Who are their people and how do we support them in addition to the patient?
Nice. So that whole patient care is so
Right.
important. And I think that sometimes we forget that it's not just the patient, it's their whole family or those that are important to them and care for them. So what's the difference between palliative care and hospice?
So we like to think about, most of us like to think about palliative care as sort of an umbrella of care. And under that umbrella is hospice care. So hospice care is designated by Medicare, and it's a benefit that says that if you have 6 months or less to live and somebody signs a piece of paper that says that you can receive these services. And palliative care is before hospice care, or it's over hospice care. So palliative care is for anyone with a chronic condition, anyone with things, I think we don't think about people with chronic renal disease, bad diabetes, maybe bad heart disease. People with Alzheimer's can qualify for palliative care. And it's a way to sort of focus on that whole person care in addition to still seeing your regular cardiologist, still seeing your regular neurologist. So where hospice care is really transferring your care mostly to a hospice team and a hospice physician. Palliative care still allows you to see all the people you were seeing before, your neurologist, your cardiologist, and still get these extra services that look at you as a whole person and can help with things like support in the community and pain management. So it's a bigger thing than hospice care, and it also is reimbursed by many insurances, because that's something else I think that we worry about is who's going to pay for this.
Oh, that's really interesting. So whether you're Medicare or private insurance, Medicaid, they tend to have some sort of reimbursement.
They do.
I think everyone would have to check with their own carrier.
Absolutely right. So check with your carrier. And then as we like to say, especially in pediatric palliative care, that sometimes when they say no, then you just need to ask it a different way, or to get, see if there's a case manager within your insurance company that can help advocate for you.
That's great. That's great. So tell me, in light of COVID-19, how do you see people's perception of palliative care changing? Because I know people, I'll talk about palliative care and they think, they think it's death. They think, oh, that's just related to death. I have to be dying. Do you see that with COVID-19, this is going to change the way people perceive palliative care or hospice care?
I hope so, because I think what we're seeing with patients with COVID-19 is one of the things we're seeing is this isolation, sometimes from their family. And so how do we help manage that? And we manage that by providing whole person care, by providing psychosocial support. And many of these patients with COVID-19 are really ill, and many get better.
Yes.
And so in that process, what have we learned about taking care of the whole person and recognizing that palliative care is appropriate for those patients when they're critically ill? And a lot of these patients that are critically ill that will get better may still have some rehab issues or some other chronic health issues. So hopefully the palliative care programs and people and the philosophy will follow those people into that. And then hopefully we will get more people thinking about palliative care as part of care and not separate as hospice care is sometimes considered.
So if someone wants to talk to their doctor about initiating palliative care, how would you recommend they go about that?
So I think to ask the question up front, maybe to do a little bit of research, because I do think many physicians still think about palliative care as hospice care. So sometimes as consumers, we have to be as well educated as our physician or providers are. And so to ask about palliative care from the idea of, I have a chronic illness and I have a lot of things going on, do you think palliative care would be something that I could benefit from? And then have that conversation. I do think that some physicians will say, well, you're not dying and you don't need hospice care. And then it's one of the frustrating things sometimes about being a consumer, but having to then say to your provider, I know, and palliative care is different, and then kind of having that conversation there. But you have to ask, I think.
Well, Kathy, thank you so much for taking time out today and just educating us a little bit. And I hope that all of you that are listening will become advocates for yourself and those that you love, because that's the way that they can just get the best care possible for them. And that is what our goal is, to have the whole person, the whole family, the whole community treated. So Kathy, thank you for sharing your expertise. I appreciate it. And I will sign off. Maureen Kierce with Radiant Morning, and Kathy Perko, amazing pediatric nurse practitioner in palliative care.
Thank you, Maureen.
Thanks.
Thank you.